Alright, let's clear up a question I get all the time. What's the real difference between physicians and nurse practitioners? Let's start with education. To become a physician, I had to complete a 4-year undergraduate degree, then 4 years of medical school, followed by a residency that can last anywhere from 3 to 7 years, sometimes even longer for certain specialties. Some of us also go through a 1 to 3 year fellowship program. That's well over a decade of intense hands-on training. Nurse practitioners, or NPs, also start with a 4-year undergraduate degree, usually in nursing. Then, they pursue a master's or doctoral program, which typically takes 2 to possibly 4 years, and in many cases can be done online, which is not the case for physicians and medical school. While that's a significant commitment, the clinical training hours are much less, often around 500 hours that are required, compared to the 15,000 plus that physicians rack up during residency alone. Now let's talk about scope of practice. Physicians practice within the medical model and are trained to diagnose and treat the full spectrum of medical conditions, from the simple to the incredibly complex. We're prepared to handle rare diseases, perform surgeries, and manage life-threatening emergencies, as well as routine checkups and follow-ups, and can prescribe all necessary medications. Nurse practitioners practice within the nursing model and focus more on primary care, preventative medicine, and routine health issues. They are not permitted to perform any type of surgical procedures. In some states, they can practice independently, but in others, they work under physician supervision. Texas is one of the states where physician supervision is required as a safety net for patients. Their scope is considerably more limited compared to what physicians can do, especially when it comes to complex cases or specialized procedures. While they are able to order and interpret diagnostic and lab testing, as well as prescribe non-Schedule II medications, they are not necessarily trained in those areas as part of their education. So exactly what is the primary difference in the two models, medical versus nursing, that I mentioned? The medical model teaches physicians to take the patient history, and use the data they collect to formulate an assessment or differential diagnosis and form a plan to carry out treatment. The nursing model generally teaches symptom treatment with little to no emphasis on diagnostic and treatment planning. Here's where clinical depth comes in. Physicians spend years honing diagnostic skills and learning to manage the unexpected. We're trained to see patterns, catch subtle signs, and dig deep when answers aren't obvious. That's not to say NPs aren't skilled. They absolutely are. But the depth of our education and length of our training sets us miles apart, especially in high stakes or complicated situations. The best approach to patient care is with a team modality, physicians and nurse practitioners working together to ensure the health and safety of all patients. This provides patients with good access to care while providing a level of protection that is necessary to keep you safe. So, if you're wondering who to see for a basic checkup with no complicated health conditions, both are great options. If the NP is working with a supervising physician just in case something arises. But when it comes to complex diagnoses or specialized care, the extensive training and experience of a physician can make a real difference. If you are unsure of your situation, it is best to see the physician, as their higher degree of knowledge will probably set your mind at ease. Hope this clears things up. If you have more questions about healthcare roles, check out txphysicians4patients.com for more information.